Hello everyone, welcome back to my channel Dr.shil's Physio Victory. Today it is the third part of GSSSB 2020 series. So let's start. Today's first question is hemiplegitis is due to lesion in option A subthalamic nuclei or nucleus, option B red nucleus, option C putamen, and option D none of the above. Here, the correct answer is option A, subthalamic nuclei, because subthalamic nuclei controls inhibition of excessive movement. So, if there is lesion in the subthalamic nuclei, it comes out with wild flinging. Red nuclei basically controls flexotron, putamen. Lesion basically causes chorea, rigidity. Next, come to question number 52. The frequency of manual vibration is option A 5 to 12 Hz, option B 12 to 20 Hz, option C 20 to 35 Hz, option D none of the above. Here the correct answer is option B 12 to 20 Hz. Optimal frequency for chest physiotherapy is physiotherapy is 12 to 20 Hz. Next, come to question number 53. Cause of Bell's palsy is option A idiopathic, option B vascular, option C trauma, option D cold exposure. Here the correct answer is option A idiopathic. Or cold exposure is a old phenomenon. Next, come to question number 54. For the activation and training of multifidus muscle, the position is option A prone with your palpating digits immediately lateral to the spinous process of the lumbar spine. Option B side-lying with your palpating digits immediately lateral to the spinous process of lumbar spine. Option C both A and B. Option D none of the above. So both are correct option. Option C is the correct option. Multifidus can be palpated in the both positions. Next, come to question number 55. Conventional tense is option A high intensity low frequency stimulation, option B low intensity low frequency stimulation, option C high intensity high frequency stimulation, option D high frequency low intensity stimulation. Here the correct answer is option D high frequency low intensity stimulation. This is the conventional tense. It is basically 50 to 100 Hertz or 80 to 150 Hertz and pulse width 50 to 100 microsecond. Now, high intensity, low frequency stimulus is actually acupuncture like trends. Low intensity, low frequency, uh, basically not a standard type, and high intensity, high frequency is intense tense. Basically, it is a intense. Next, come to question number 56. Which one of these is a characteristics of ATP-PC system? Option A, glycogen is the fuel source. Option B, major source of energy during first 30 seconds of intense exercise. Option C, major source of energy during from 30 to 90 seconds of exercise. Option D, major source of energy after the second minute of exercise. Here, the correct answer is option B, major source of energy during first 30 seconds of intense exercise. Basically, there is three energy system. One is aerobic system, two is ATP PC system, and three is anaerobic system or system or lactic acid system. So actually, in ATP-PC system is dominated energy source during first 30 seconds, like heavy lifting, jumping, and for anaerobic basically is 30 to 90 is anaerobic or lactic acid system, and aerobic is after 2 seconds it is aerobic, and in aerobic glycogen is used as fuel source. Next, come to question number 57. Which one of the following is not due to the pelvic floor musculature? Option A, it helps in the generation of intra-abdominal pressure. Option B, it assists in unloading the spine. Option C, it has an excitatory effect on bladder activity. Option D, mm, it maintains the anorectal angle. So here the correct answer is option C, because it basically not excite, it inhibits bladder. Next, come to question number 58. Spirometry does not determine the option A, tidal volume, option B, inspiratory reserve volume, option C, vital capacity, option D, residual volume. Here the correct answer is option D, residual volume. Residual volume is not measured by the spirometry. Residual volume, what is residual volume? The amount of air that remains in the lungs after a maximal forced expiration. What is vital capacity? Vital capacity is inspiratory reserve volume plus tidal volume plus expiratory reserve volume. Next, come to question number 59. Ataxia of the trunk is seen in lesion of option A cerebellar vermis, option B neocerebellum, option C archicerebellum, option D paliocerebellum. Here the correct answer is option A cerebellar vermis. Cerebellar vermis basically controls trunk, neocerebellum controls limb coordination, archicerebellum controls balance, paliocerebellum controls muscle tone. Archicerebellum is also called the vestibulocerebellum. Next, come to question number 60. 10 RM load refers to option A weight can be lifted less than 10 times as it is too heavy. Option B, a maximum weight that can be lifted for maximum 10 times. Option C, a minimum weight that can be lifted for maximum 10 times. Option D, a weight that can be lifted only 10 times and is too heavy to be lift more than 10 times. To be lift more than 10 times. So, here the correct answer is option D. Next, come to question number 61. Single bar AFO with medial strap is helpful in correcting which of these deformities? Option A, equinus foot. Option B, cavus foot. Option C, pronated foot. Option D, CTEV. Here, the correct answer is option C, pronated foot. Pronated foot, medial strap, cavus foot needs lateral support, equinus foot needs a posterior strap. Please tell me which orthosis or prosthesis is used or in CTEV in the comment box. Next, come to question number 62. Klippel-Feil anomaly refers to as option A, congenital fusion of ring of Atlas. Option B, inherent instability between C1 and C2. Option C, congenital fusion of two or more vertebra. Option D, absence of axis vertebra. Here, the correct answer is option C, congenital fusion of two or more vertebra. Basically, Klippel-Feil syndrome characterized by congenital fusion of two or more vertebra. classic features are option three classic features there: short neck to low posterior hairline, three limited neck movement, especially rotation and lateral flexion. Next, come to question number 63. Following are common occupational disease except option A pneumoconiosis, option B paresthesis, option C asbestosis, option D bicyanosis. Here the correct answer is option B. Paresthesis disease is not any type of occupational disease. Pneumoconiosis is a classical group of occupational lung disease, especially from mineral dusts like silicon or silicosis or coal workers. Asbestosis is also a occupational disease because of the inhalation of asbestos fibers, and bicyanosis is also occupational lung disease from cotton or flax or dust. Paresthesis or lack of paresthesis disease is a childhood idiopathic avascular necrosis. Next, come to question number 64. Dopamine is secreted by neurons that originates in the option A substantia nigra, option B substantia gelatinosa, option C median raphe of the brainstem, option D reticular formation. Here the correct answer is option A substantia nigra. Substantia nigra is the correct answer. Full name is substantia nigra pars compacta. Substantia gelatinosa is a part of dorsal horn of the spinal cord, lamina 2, involved in basically pain modulation. Mostly contain enkephalin, GABA, and median raphe of the brainstem is a major source of serotonin. Next, come to question number 65. Flutter is which type of device? Option A, high frequency PEP device. Option C, chest compressor. Option B is chest compression. Option C is vibrator. Option D, none of the above. Here, the clear answer is high frequency PEP device. Next, come to question number 66. Which one of these is not considered as an activity limitation? Option A, having pain. Option B, not able to comb the hair. Option C, not able to dress up. Option D, not able to eat with spoon. Is also a flat question. Option A is the correct answer. Next, come to question number 67. In DSSSB, the base repetition maximum is. This is a one-liner question. Option A, 10 RM. Option B, 1 RM. Option C, 6 RM. And option D, as many as possible. Here, the correct answer is option C, 6 RM. Next, come to question number 68. A high ulnar and low median nerve palsy affection in leprosy causes option A, partial claw hand. Option B, total claw hand. Option C, total claw with flat thumb. Option D, intrinsic plus syndrome. So here the correct answer is total claw with flat thumb. Higher ulnar nerve pulse is above elbow or proximal, and which lead to basically most basically ulnar nerve supplies most interosseous hypothenar muscle, adductor pollicis, and deep head of the flexor pollicis brevis, and lumbrical 3 and 4, which results in complete clawing. All four fingers, and low median nerve pulse basically is at wrist or distal. It leads to flat thumb, because uh, is basically affects the adductor pollicis brevis, opponent's pollicis, superficial head of flexor pollicis brevis, and lumbrical 1 and 2. Next, come to question number 69. Which one does not belong to activity and participation? Option A, learning and applying knowledge. Option B, communication. Option C, respiration. Option D, self-care. Here, the correct answer is option C, respiration. Respiration basically a body function. Other options are basically activity and participation. Next, come to question number 70. A breathing technique wherein the patient is taught to force air into the lung by using his mouth, tongue, pharyngeal and laryngeal structures is referred to as option A, pursed lip breathing, option B, glossopharyngeal breathing, option C, lateral costal breathing, option D, diaphragmatic breathing. So here the correct answer is option B, glossopharyngeal breathing, or is also called air gulping. Pursed lip breathing seen in COPD. Lateral costal is rib expansion. Diaphragmatic breathing is a normal breathing pattern. Next, come to question number 71. The ability of a diagnostic test to identify the condition when it is present is called as option A, sensitivity, option B, sorry, B is here. So option B is specificity, option C is suitability, and option D is stability. Here the correct answer is option A, sensitivity. Sensitivity is the ability of a diagnostic test to correctly identify those with the disease when the condition is actually present. And specificity basically is the ability of the test to correctly identify those without the disease. Specificity is basically measures ability to identify absence of disease, not presence. Sensitivity is presence of disease. Next, come to question number 72. Blount's disease is commonly known as option A, tibia valgus, option B, tibial torsion, option C, femoral torsion, option D, tibia varus. Here the correct answer is option D, tibia varus. Blount's disease also known as tibia vera, or is also called the infantile tibia vera. Basically, it is a developmental disorder of the proximal tibial growth plate. Proximal tibial growth plate. It leads to progressive bowing of the lower leg below the knee. Next, come to question number 73. Which one of these is true rib? So, option A, 7th rib, option B, 8th rib, option C, 10th rib, option D, 12th rib. So, 7th rib is the correct answer because it is only true rib. 8th and 10th is false rib and 12th is floating rib which are directly connected to the sternum is called true rib. Next, come to question number 74. Which one of these is not an upper extremity rehabilitation for stroke? Option is option A, CIMT, option B, PNF, option C, MRP, option D, ULTT. Here, the correct answer is option D. Upper limb tension test is a diagnostic test, not an extremity rehabilitation for stroke. CIMT is constraint induced movement therapy. PNF is proprioceptive neuromuscular facilitation. MRP is motor relearning program. In CIMT, basically, this is a well-established evidence-based rehabilitation approach for upper extremity recovery post-stroke. It involves restraining the unaffected arm to force intensive use of the affected arm, promoting neuroplasticity and functional gains. Next, come to question number 75. Which one of this stretching technique is not considered as part of PNF stretching? Option A, slow, relaxed, passive stretching. Option B, hold, relax. Option C, contract, relax. Option D, agonist contraction. Here, the correct answer is slow, relaxed, passive stretching is not a part of PNF stretching. Thank you everyone for watching this video. Please do like, subscribe and comment in the pin section. Please stay tuned for the last video of this series. Bye.